Placenta previa occurs when the placenta develops in the lower part of the uterus rather than the upper part. 3 degrees, marginals, placenta reaches within 2 to 3 centimeters of the cervical opening. Partial, partly covers the cervix. Total, completely covers. Manifestations. The main characteristic is painless, bright red vaginal bleeding. 2. Fetus in abnormal position because the placenta occupies the lower uterus, which often prevents the fetus from assuming the normal cephalic presentation. Complications. 1. Hemorrhage may occur because the lower segment of the uterus where the placenta was attached has fewer muscle fibers than the upper uterus, the resulting weak contraction. A woman's risk for hemorrhage increases as term approaches and cervix begins to efface. 2. Fetal anemia and hypovolemic shock. Fetus may experience anemia or hypovolemic shock because of the blood loss. 3. Fetal hypoxia may occur if a large disruption of the placental surface reduces the transfer of oxygen and nutrients. Treatment depends on the length of gestation. 1. Medications for fetal lung maturity. 2. Fetal delivery, done if distress is noted. 3. Side lying, pillow under one hip to avoid supine hypotension. 4. Cesarean section for partial or total, but vaginal delivery may be performed. Nursing care. Monitor fetal heart rate, character of contraction. It is considered continuously. Document and report vaginal blood and symptoms of shock. Vital signs every 15 minutes if the woman is actively bleeding. Oxygen. Vaginal examination is not done. May precipitate bleeding if the placental attachment is disrupted. Supportive care. Parents are often fearful for their child, particularly if preterm delivery. Let us check your knowledge through quiz. On. A pregnant client at 34 weeks gestation presents with painless, bright red vaginal bleeding. Which condition should the nurse suspect? A. Abruptio placentae. B. Placenta previa. C. Ectopic pregnancy. D. Threatened abortion. Correct answer, B. Placenta previa. 2. A client is diagnosed with placenta previa, in which the placenta completely covers the cervical opening. How should this condition be classified? A. Marginal placenta previa. B. Low-lying placenta previa. C. Partial placenta previa. D. Total placenta previa. Correct answer, D. Total placenta previa. 3. Which fetal presentation is most commonly associated with placenta previa? A. Cephalic presentation. B. Occiput anterior presentation. C. Breech or transverse presentation. D. Vertex presentation. Correct answer, C. Breech or transverse presentation. 4. The nurse is caring for a client with suspected placenta previa who is experiencing vaginal bleeding. Which intervention is contraindicated? A. Monitoring fetal heart rate. B. Administering oxygen as prescribed. C. Performing a vaginal examination. D. Assessing vital signs every 15 minutes. Correct answer, C. Performing a vaginal examination. 5. A nurse explains to a student that a woman with placenta previa is at increased risk for hemorrhage near term because A. The placenta separates prematurely from the uterine wall. B. The lower uterine segment has fewer muscle fibers and contracts poorly. C. The fetus compresses the placenta during labor. D. Maternal blood pressure rises significantly during pregnancy. Correct answer, B. The lower uterine segment has fewer muscle fibers and contracts poorly.